Ahoy, dear friends from all over the world. This is Dr. Bertolomescu, the Medical Futurist, and I welcome you to a new The Medical Futurist live Q&A here on YouTube. Thank you so much for being with me today. It's quite a special Q&A today because the primary goal of this session is not to answer 100 questions like always about a specific topic around the future of medicine and healthcare, but I wanted to have a futurist exercise with you. The plan is that we will predict the future together. Actually, even more, I guarantee you that if you do this exercise with me in the next 55 minutes or so, you will be amazingly better at forecasting the outcomes of events, even in geopolitics, in culture, in sports, in healthcare, in technologies, because literally I will go through a lot of forecasting exercises with you. Either if you have any experience in that, if you're a futurist yourself, or if you have never done anything like that in your life, welcome to the show. That's what we plan to do in the next hour. As usual, just a few housekeeping rules. Please be very kind in the chat. Please confirm if you can see me and hear me well enough, because I never know. If you have any questions, by the way, about the future of medicine, healthcare, about the job that we do at the Medical Futurist, please feel free to ask. I also plan to go through a few questions that you submitted through the Eventbrite website. Also, welcome those arriving from the Eventbrite website. We have quite exciting stuff cooking up for you in the next couple of weeks about these live streams. Thank you, Michael Rada, for confirming that you can see me and hear me well. Clean and sharp, that's what I need. Thank you, Balint, for the nice gesture. So in the meantime, welcoming you from all over the world. As usual, I love seeing where you are coming from. So if you could just drop one line about the city or the country you're joining us from, I would really appreciate that. It feels great to get a context about the global perspectives we will have today. Just checking the comment section now. Thank you for the support from the Semmelweis University. Thank you, Mac by Thesia. It's so important to exercise these envision the future muscles. Thank you so much for saying that. One of my main goals as the medical futurist is to make sure that everyone learns how to spend more time in the future, because I'm very confident that this is the muscle that we kind of need to better prepare for whatever is coming next. So yeah, seeing that you're coming from the Florida, the US, Czech Republic, Plzeň, good luck for you now. You have to beat Inter in the Champions League, so FC Barcelona has a chance to qualify for the next round. Orlando, Florida, Connecticut, Spain, Bangladesh, Berlin, Germany, Geneva, the Netherlands, Chennai, India. It's so great to see you guys here from all over the world. Just very quickly, for those who don't know me or the Medical Futurist, I'm a professional futurist with a medical background, and my job is to provide context around the technological changes in healthcare. And I do that with the support of a great team, 15 people at the Medical Futurist, where we try to provide details about these technological advancements in social media, on medicalfuturist.com, on our YouTube channel, in the form of ebooks, articles, keynotes, books, and any kinds of presentations. Plus, at the Medical Futurist Institute, we do the same kind of work, but through peer-reviewed research. We publish studies and papers about the paradigm shift we call digital health and the impact artificial intelligence will have on the near future of medicine and healthcare. Enrique, yes, absolutely. Visca Barça. Hi from Dublin, Israel, Colombia. It's so great. Let's get into that, guys, because I have been cooking up many things for you for this session. In the first few minutes, let me just answer a few questions that arrived through the Eventbrite website. So there's this one from Per Söderström. What is the role of personal health tech? It's quite a general question. The role of personal health tech is to help patients obtain data they already have, but they don't have the interfaces to access them. And this way they can get engaged with their own care. This is the whole point of patient empowerment. This is why the paradigm shift we call digital health is taking place in healthcare right now. Ellen Backers had a question about neurofeedback devices. Where do you see neurofeedback's place in the future of personal evolution and healing? It's a good point that most of these health sensors have been coming from the cardiology, chronic disease prevention fields, not from neurofeedback. But I see a role for EEG-based head sensors for making people meditate more or find their own way how to meditate better. Otherwise, I think neurofeedback devices are a bit far-fetched for now. Shandor Mucci has a question about what development do you see in the cardiac examination of the future? Actually, I'm happy to share with you that about that question. Let me share a link in the comment section. I published a paper about this, about the near future of cardiology. So I hope that you will find it useful. Vantage Research, thank you so much for loving the infographics we produce. I will pass it on to our great designers. Are you planning anything on medical education trends, the use of technology in medical education? I think we have covered that quite extensively on medicalfuturist.com, such as in this article, which I'm just sharing with you in the chat. A few more questions before I jump into the forecasting exercise. It's a good one. Which jobs in healthcare do you foresee being phased out in the near future or incorporated into other positions? Wayne Leong asked that question. And if you think I'm not prepared, you're wrong, because I published an analysis about this based on the impact of automation on the top 20 medical specialties. So please feel free to look into this. A few more from Michael Rada. Will the healthcare back to the roots and use the ancient knowledge combined with modern technology? Well, that would be the plan. That even if automation, AI-based medical decision support, even if health sensors and direct consumer genomic tests can contribute a lot to patients' well-being, it would make sense to combine still experience, human vision, human expertise with all that amazing knowledge and insights coming from the use of those technologies. For that, of course, you have to train the healthcare workforce in a different way. IFI 2022, do you see home care replacing hospitals as a primary place of care? Not in this sense, replacing it entirely, but it will be just financially unsustainable to keep on allowing patients to meet a healthcare professional with any kind of health issue, even minor ones. We have covered this quite extensively in the newest ebook I'm just sharing with you. We published about 2 weeks ago about the future of hospitals, the hospitals from the future. In that, I described in so many details about how the point of care will shift from physical buildings to wherever patients are. All right. Katarzyna, what would your answer when asked about what top technologies are there for the improvement of our quality of life? Non-disease related question. You will hate me for sharing links about all these, but I published so many analyses that instead of giving you like a 2 sentences long answer, why not giving you all the major technological trends I see to be exciting? And this one here is the 50 trends I put together on a hype cycle list. Madeline Mayer, thank you for making your ebook so cost-effective for learners. Thank you so much for saying that. I'm very happy, and the whole Medical Futurist team is very happy about that. Now, let's do some forecasting exercise. Of course, if you have any questions, please leave a comment and I will get back to them eventually. Shandor Mucci, of course, it's my pleasure. And now I wanted to share with you one of the, in everyone's life, there is one thing they are the most proud of professionally, but no one cares about that. I would love to hear what this thing is in your life. Mine is that I'm a super forecaster in the Good Judgment project. Nobody cares about that, but that's one of the proudest things I've ever done as a professional futurist. In short, there is a community site called the Good Judgment Project. Let me share it with you. And here you can learn how to forecast better. This was launched many years ago by a great futurist. Actually, I have the book here. I want to share the book with you, which I forgot to put on my table. So here it is. This book was the first idea, super forecasting, the art and science of prediction. From this book, I learned that there is a community called the Good Judgment Project, which is a community of people who want to do forecasts together. Some of them are professional futurists like me. Some others are retired teachers or students, literally from around the world. And what they do is that we try to forecast the outcome of different events, geopolitical questions, cultural issues, sport questions. And by trying to provide an answer to that question, we gradually become better at forecasting. This thing here is something I wanted to share with you. There was a competition in the world around predicting the outcomes of geopolitical questions and events. And what you can see here is that the blue line represents the results from the Good Judgment Project team, again, a community of like-minded people, while the gray line represents the results of the rest of the teams in the competition. And you can see the difference between how they perform. So after 2 years, they had to cancel the competition because there was no reason for continuing doing that, because of the Good Judgment team simply winning it at with such a great margin that it just became that there was no reason to keep on doing the event. And what I learned along the way in the Good Judgment Project is that there are certain things that good forecasters might want to keep in mind. One thing is that we don't say that a certain event will definitely happen or not happen, but we try to provide granular responses, not even inevitable, maybe impossible, not even very likely, maybe unlikely, very unlikely, but we're going down to the level of details, to the right percentages. I think the chance of this question to have a yes as the answer at the outcome would be like 74%. That's one thing that good forecasters definitely do. One other thing that we like to do is that we ask the right questions. So I would go through exercises with you in a couple of minutes, and I would try to come up with the right questions that would help us to do a good forecast about a certain event. So just to give you an example what I'm talking about here. If I show you this image, happy couple at their wedding, and my question to you is, what would be your prediction, your percentage, the chance that this couple would get divorced in 10 years? I'm curious, what question would you ask yourself first? Literally, I will wait like 1 or 2 minutes to see what kind of things you would start thinking about. What is the chance that this happy couple, seeing a photo on their wedding day, would get divorced in 10 years? What would be your first question to yourself? And then we will go from there. Let's not start with providing predictions, but Michael, if you say your prediction is 45%, let's provide some rationales why you think it's 45%. Banashkiev, where do they live? That's a very smart question to ask. Most people, let's see, what's the population probability? Okay, Jorge Cardona, thank you again for being on the live show, 80%. What is their financial status? It's a good question. Educational level. What is the age difference between them? That's also a smart question to ask. Anything else? How long did they date before marriage? Well, you need to find good studies showing that there is a correlation between how long people are dating and then whether they get divorced or not. Do they reinforce each other many times each day? That's something almost impossible to quantify. Therefore, it's hard to evaluate based on that, but it's a good question when we think about the outcome of that event. How about their parents? Maybe they had divorce rates or something like that. Did they live together? What is the base rate for divorce? Very smart question to ask. Religious affiliation. Do they have common life goals? Wow, guys, you're coming up with amazing stuff. Actually, kids on board already. Almost all these things can be used. You are not, regular people. Regular people would say that, well, it's like 5 or 10%. Why would they get divorced? They are a happy couple. But every couple, well, in an ideal way, every couple looks happy on their wedding photos. The right question to ask is their zip code. And then checking what's the divorce rate under their zip code in their locations. That's why I love the question of Banashkiev about where do they live. That's the right question to ask. Where they live, there is a divorce rate. And that would be the baseline. Let's start with that baseline. And after that, we have something to work with. We have a number, like it will be, I don't know, 22%. That's the number we will start working with. And then we can ask all these other questions about their educational levels, whether their parents were divorced, whether they have kids already, whether they live together, their religious differences, all these things. Amazing stuff, guys, amazing stuff. And that's where we start. So that's why good forecasters are granular. We go into the percentage, the details. Good forecasters ask the right questions. And one more thing here, good forecasters keep scores. Without keeping scores, it's almost impossible to improve at doing forecasts. And for that, the Good Judgment Project uses a score called the Breer score. This score just measures the accuracy of probability judgments. In short, if your Breer score is more than 0.5, it's around 1, it means even a coin flip is more efficient than your forecast. If your Breer score is around 0.4, it means you're a typical forecaster doing a good job on the Good Judgment Project. If it's below 0.3, 0.2, it means you can be qualified to become a super forecaster like I did in 2019, one of the emails in my life that made me the proudest and happiest, literally, as a futurist. So we start from these basics. We will think about asking the right questions. We will try to be as detailed as possible. We will keep scores, and we will try to provide outcomes for different events. And my plan for today, while just looking at the chat for a second, okay, that we would just choose questions. Well, I chose questions, for a reason, because some of them are light, some of them are hard. There are questions I chose which are really specific to healthcare and which have nothing to do with it. So we would have all these things on a whole range of issues and probabilities. And we would start with this. A light thing to start with. Which football soccer club will win the 2022-23 UEFA Champions League final? As things stand today, it will not be my beloved team FC Barcelona, but there are some, of course, there is a reason why the Good Judgment Project administrators ask certain questions, and they are the ones providing the possible answers too. So in that case, here is the question. Here are some clarifications about how the outcome will be determined, and here are the possible answers. And of course, you have 100%. You have 100 points to divide in between these groups of potential answers. There are certain clubs mentioned here, and there is a last group saying another football club, if any other might come in mind. So I thought that we would start with the basics. Like in that case, I think it would make sense to look at the last few years Champions League winners. I hope that you are seeing this. Yes, you see this. Team records and statistics. Here are the finals. Last few years. Of course, I think these are the best finals when FC Barcelona could win it with Lionel Messi. But since then, let's see the last 5 years. Real Madrid won one, and then Liverpool against Tottenham, then once Bayern Munich against PSG, then Chelsea, then Real Madrid. What I see in the last 5 years is that it's quite English club oriented, as you can see. Out of the 10 potential members of the finals, 2, 4, 6 were from England, and 3 were from Spain. That's like a baseline we can start with. So I would say that seeing the current forms of these clubs in their respective national leagues, I would say that Barcelona has almost a zero chance. Even if Inter beats Victoria Pilsen today, they have literally a mathematical zero chance of winning that. Bayern Munich is always great. I would start with somewhere around 10, 15, and then we will see. As an English club, as a club having a good track record in Champions League, I would go with Chelsea with 15. Liverpool, amazing club in the last few years, but now they are struggling in their respective league. So I would bring them maybe below Chelsea. Manchester City, if you saw Haaland playing these days, then you would say that they will win the Champions League for sure. But of course, a good forecaster doesn't say that. We are trying to be granular. So I would definitely put Manchester City on the top of the other clubs. PSG, especially with Lionel Messi, has a strong chance for winning that. Real Madrid always has a chance to win it. Tottenham, not so much these days. I'm not even sure if they are in the current format. Let's check it out. Which clubs we do have in the group format here. So Liverpool has quite a good chance. They will qualify. They have qualified already from that group. Nobody here in our group. Barcelona will get relegated. Bayern Munich will get through. Tottenham seems to be close to going through, but they're also close to relegation, so we don't know yet. That's why I would bring their chance down a little bit, somewhere here. Okay, Chelsea on the top in their group, Real Madrid advancing to the next stage, Manchester City doing the same, PSG. Maybe other club, you see that there is one group here with another football club, and one might have a case for Benfica, Borussia Dortmund, Leipzig, Milan, Marseille, Inter Milan. I wouldn't give this more than like the rest, 8%. This way we have the 100% ready, and I would go for Manchester City. So I think the rationals I described to you, I don't have the time now to write the rationals, but of course you're always encouraged to provide rationals for your forecasts. And now I submit it. And now comes one of, if not the most important part of being a good forecaster. It's being able to evaluate your decisions based on new information. So let me just, stop here for a second. You might have amazing skills at doing forecasts, and maybe you do make good decisions when providing those forecasts. But decisions, opinions, insights, information change over time. And good forecasters always come back to their scores and evaluate. If a new thing comes to mind, if a new information arises, I will change my opinion. And that's being that open-minded is a key aspect of being a good forecaster. So in that case, as you can see, I will indicate that, well, maybe in 1 week, notify me through email that I should revisit this question again. And now I stop here for a second to see if you have any questions about the forecasting exercise so far. Heinrich Tessendorf, thank you for the question about the decentralized science. Actually, we are working on that. The editorial team has been working on that, and we will publish like a summary article on medicalfuturist.com for sure. Jorge Cardona, that's what we've been talking about, that good forecasters are granular. You don't say that they will win for sure because you don't know if they win for sure. Just check the baseball season. Those that were determined to win for sure, Atlanta Braves, the Dodgers, the Yankees, they all got relegated, and now none of these teams is in the World Series. So let's not say for sure. You might feel that they have an absolutely strong case, but then you go to like 40%, that if you're that confident about your prediction, but you cannot say that it's 100% because you can lose a lot. And if they don't win it at the end, why there were like 8 candidates for winning it, and you put 100% on Manchester City and they end up losing the final, not even getting to the final, your Breeze score will be amazingly low. Thus, you will be a bad forecaster. All right, now let me get into a second question. It's not about football in this case. Let's see something healthcare related. Why not? This question is around COVID. What will be the total number of new cases of COVID-19 in the US between the 24th of October 2022 and the 23rd of November 2022? As you can see, the question is very specific. That's the only way to be able to determine the outcomes. Plus, the question describes, the clarification describes how exactly it will be determined that what's the outcome of this. There is a database being published on GitHub here, and that's where you will find the right numbers. Well, the way I would start doing this is that since the very early days of COVID, I've been using this database. I know it's not the official database worldwide, but this is this is something I've been trusting for more than 2 years now. They have been very accurate and up to date. And the way I try to determine this is that I always looked at the official numbers from my country, from Hungary, and I compared them to what they have here on worldometers.info. It has been very accurate over the last 2 years. So what I would do here is that I would just click on the USA and see their most recent numbers again. What was the question? The total number of new cases of COVID-19 just in the US between these two dates. So we should look for like, it was just 2 days ago, so we should look for like the last month and maybe the month before that. And all these dates, here are the daily new cases and active cases. All right, daily new cases, United States. In the last couple of days, it has been around 30 plus, 40,000 plus. But since September, it has been declining to 30,000. It's even lower now, 20, 30,000. So I would start with somewhere around 30,000 on average. For this, I have to determine how many days are between these two dates. And I don't want to count it, but Google does it for me, 30 days. So I would go with 30 days slash 30 days, 30 times 30,000. It would be around 900,000. But for this, I would consider that the rate will be the same day by day, 30,000 on average every single day. Seeing the trends here, it would make sense to be that optimistic, but it's the end of October until the end of November. Not only flu cases will come into the picture, but vaccination rates also comes into the picture. So I would not be as optimistic to consider that this rate of decline will keep on being the same. I will be a bit more pessimistic about that. And I would say that it will be around 30,000 on average, sometimes a bit more, sometimes a bit less. It would be a bit over 1 million. That would be my baseline. And as you can see, that's where I start. I don't want to be influenced by just the potential answers. So I start with a baseline on my own research. Then I check the potential answers here. And as you can see, it's quite the pessimistic scenario going on. Even the last bracket having more than 6.5 million COVID-19 cases in those 30 days. So what would make sense for me here is to put the highest number somewhere around 1.5 million. Like I cannot be that pessimistic. Okay, maybe a bit more. Somewhere around that. And then what I do usually is that I check the crowd forecast. First of all, in this activity tab, you can see all the forecasts before yours. On the crowd forecast tab, you can see what the crowd has been saying about that. This is the crowd forecast. All the people who have provided a forecast in the last couple of days, 36 people provided forecast. This is the crowd forecast average. As you can see, they got something similar results like me. It would be the bracket with the highest percentage would be the one bracket that I also thought to be the highest, between 1 and 1.5 million, something around that. It seems that my estimations are not as granular as the crowd forecast, so they might make a good point. Let's be a bit more objective about this, and I bring everything down and I provide a bit more percentages even to the lower or higher groups, but I still remain confident that this is going to be the winning bracket. You see, I don't say it's 80 or 90%, I say 42%. Again, I don't have time to provide rationals in writing, but I've been telling you my rationals. I submit it, and again, as usual, I want to get reminded after 1 week to make sure I can keep on fine-tuning my results. All right. I want to check the questions just for a second, in case you have any. Megbite this year. You're defining the future as near term, but your topic is the future of healthcare and you're talking many years out. We forecast 10 years out and must approach it by envisioning 2031. It depends on what your goals are as a forecaster. In many analyses we publish at the Medical Futurist, I think our forecasts are more about the next 5 to 10 years than 10 or more. Simply because as a physician, I don't want to be a long-term futurist. I see no reason, no practical reason how to influence healthcare positively today by talking about a science fiction-like future, quantum computing 15, 20 years from now. So I tend to be a near-term futurist, and the questions we are forecasting now as part of this exercise on the Good Judgment project, I think are more about the next year, next 2 years or so. There are questions about long-term issues there too, but now I want to focus on practical stuff so you get a picture about how you can forecast these questions yourself. And the next one, I thought we could go through. Also, if you want to check out some questions on the Good Judgment project, here is the link. And if you find a question you want me to forecast for you, just let me know and we will do that as well. In the meantime, let's get back to a non-healthcare related question. In this case, it's football again, because why not? Here it is. Which country will win the 2022 FIFA World Cup? Let's not talk about all the legal and ethical issues surrounding that World Cup taking place at quite a special time in November this year. Let's focus on which country can win the World Cup. For that, I would like to introduce a baseline. And the baseline, I would base my baseline on the last like 4 or 5 previous World Cup winners. First of all, here they are. It would be Italy beating France, and then Spain beat Netherlands with Iniesta's goal, as far as I remember. Germany beating Argentina, unfortunately. France beating Croatia, and now we will see. So it's, as you can see, France had won 2 finals. Brazil took part in 3 in the last like 6 or 7 events. Germany twice. All right. The other thing I would do is I would check the FIFA World Ranking right now. Here is the men ranking. It doesn't say much most of the time, but again, it starts having a good baseline. From number 10, Denmark, Portugal, Netherlands, Spain, Italy, England, France, Argentina, Belgium, Brazil. The 2 countries I haven't seen in the last couple of finals were England and Belgium. They have quite young teams. Argentina is being led by Lionel Messi, I'm sure in his last World Cup. That would be a case for Argentina. Brazil having a very strong team this year is a good case for them. France, led by Mbappe, would be another case for them. Italy won't even be at the World Cup this year. And Spain has a very young, very strange team these years. So, okay, that's where we have a potential baseline. I would definitely put Argentina to the bracket around 12-13% because of the leadership of Lionel Messi. Belgium is always very strong. Brazil, I think, has the highest chance of winning it. England has a good chance of getting there. France is always very strong, especially in the last couple of years. Germany, not so much. You know, even my country, Hungary, could beat them in the Nations Cup. Netherlands, very young team. Portugal, led by Ronaldo, is always strong. Spain, I think, is too young for this, and I have to give another country a certain chance. No country winning the World Cup would mean that the World Cup wouldn't take place. I just don't see this happening, not even due to COVID or any other kinds of issues. Out of curiosity, let me check the crowd forecast. They are leaning, the dark blue stands for the crowd forecast. The crowd is leaning towards Brazil, France, Germany, Spain. They are a bit more optimistic about Spain than I was, but I will go with that. And actually, I don't think that anything major will change in the next couple of weeks, but like remind me in 2 weeks and we will see what changes. Enough of the football questions. I get back again for a second. I should have like 4 monitors here to check everything that's happening. Brazil 100%. Jorge, that's what I've been discussing here, that you cannot be that optimistic or that confident about a country winning the World Cup just because of the reasons I've been describing so far. Let's see again a healthcare related forecast. Before the 30th of September 2023, so less than 1 year from now, Will the US Food and Drug Administration, the FDA, approve a human birth control pill for sale over the counter? And the clarification is that in this July, a French pharma company submitted an application to the FDA for what would be the first OTC birth control pill in the US. Approval, even with limits like age restrictions, would count as the positive outcome of this event. Emergency contraceptives would not count. Approval of a pill for sale OTC without a prescription but behind the counter would count. So it's quite an open-ended question. And human birth control pill for OTC. Let's take a look at what we have here. They are not available for now. It's still about the July submission. I don't see news after July, but let's see if this is the case. I check Google News, not recent, but custom range. And let's start with like from end of August until today, if there is anything new. Let's check this out. If there is a news about November, let's start with these two. The US FDA to review Perrigo's birth control pill for OTC use in November. So they will make a decision this November. The other article is about the same. So it seems that the FDA will have a meeting about this in November, and that the French pharma company did what would be considered as, their product would be considered as a positive outcome of this question if it gets approved. So the baseline would be like, for me, like between 40 and 60%. The reason why is that it's not just about a futuristic event. Such a product has been submitted to the FDA. The FDA is working on it. In November, they will provide an explanation about whether to approve or not. If they approve it, of course, it's a positive outcome. If they don't, it means other companies will have a chance to submit better submissions. So I would stop now somewhere around 55 because of that. And I would reiterate my answer in about 3 weeks. Let's see the crowd forecast. Oh, they are very optimistic about it. 70% against 30. And how many? 48 forecasters saying that. So yeah, I will go then for 60. I'm not as optimistic as the crowd for now, but I want to come back to this 2 weeks from now to see whether I have to change my opinion about that. Here is one more thing. Other forecast exercise. When will the World Health Organization announce the end of the public health emergency of international concern related to COVID-19? And the clarification is quite important here. With the rise of vaccines and treatments along with moderated cases and deaths from COVID-19, there is speculation as to when the WHO will declare an end to this public health emergency. The question would close as of the effective date of the end of this. So they will close the question when it happens. The question we have to, the answers we have to divide 100% percentages between would be these four. It would happen before January 2023, between January, March, April, June, or after July. So not before the 1st of July 2023. Well, we are quite close to the 1st of January 2023. And if we do a search for this, the WHO and this public health emergency of international concern that was announced in February 2022, I see no recent news about that. Let's get back to COVID-19. September, the Lancet Commission, yes, there was a report about that. Okay. It doesn't say anything about any updates on the COVID-19 international emergency declaration. So I go back to what we had here. I try to find some news, maybe recently, about that. Okay, it seems that six days ago, the WHO's emergency committee initiates a discussion to end declaration on global health risk for COVID-19. So the discussions are already going on. That's definitely a good sign about the positive outcome of the event. The article says what is needed to be done to declare that the emergency is over. Okay. The leader of the WHO said it was too early to lift the declaration. It was agreed. It was the 19th of October, and such discussions don't take place every week or so. So I guess they will not discuss it again in the next 2 or 3 months. For this, I would say that I would give the first bracket like almost a zero chance, 0%. Well, the crowd thinks along similar lines or ways of thought. They provide more percentages for the second group, third, but as you can see, the vast majority of the crowd don't think that it would be declared the end of emergency before the 1st of July. I will keep it being zero because it will not happen before the 1st of January. I think they will meet again, the WHO committee will meet again in about 2 months. It's like January. So if they decide that it will happen, it will take months from there. Let's be very optimistic about this, like 20, 15, 20, 12, 13 percentages. If they decide during these times, they decide that they will end the emergency, it would happen somewhere here. But I think it's just too far away to be that optimistic. Maybe not, the difference shouldn't be that big, but somewhere along the lines here, like 13, 28, and 59%. Sounds reasonable to me, but I would definitely come back to this in about, I think 4 weeks should be enough to reiterate this question. And I come back to you in a second to see whether there are any questions being asked here. Jorge Cardona, it seems that those are not sold yet in the US. Or, they are not they're not approved by the FDA to be sold over the counter. IFI 2022, it's a good idea actually to base the World Cup prediction baseline on gambling analysis because they are quite good at doing that and they have quite the money on the line for making good decisions about this. All right. Let's keep on going with our futurist exercise. The next question I thought we could try to answer is something I don't like to do because it's quite far away from me. It's something around engineering, something around sales. I don't like to do these questions. I learn a lot from these questions, but I'm not good at these. I have no basic knowledge or information about these, and that's why I don't like doing them, but I still learn a lot while trying to answer or provide forecasts for these kinds of questions. In this case, how many total vehicles will Tesla deliver to customers in 2023? They produced a record number, 343,000 vehicles in the third quarter of 2022, and it's expected to rise in 2023 based on these sources. The outcome will be determined using Tesla's official quarterly updates once available. Okay, Tesla's total deliveries of vehicles during the first 3 quarters of 2022 was 908,000. Wow. So the question is, how many total? I guess the best thing to do would be to see their first 3 quarters. Okay, I will try to find it. It's not gonna be so easy. Not financial. Here it is. Total production. Now, total deliveries. Now, this one. What if I add these numbers? It's like 8. Yeah, that would be the 900,000, right? Where is it? Not this one. This one. Yes, that would be it. So these 3 numbers, I think, add up to over 900,000. Q1, 310, and then 250, and then 340. It seems there is some there's a range, and it's like there's a difference of 100,000 delivered vehicles in between quarters. I guess it's normal to have this sort of change in between quarters. So I assume that the fourth quarter would be around between 250 and 350. And starting with that, 250 would put us at a bit over 1.1 million. It would be around 1.4 million. As you can see, the brackets are quite optimistic, even 2.6 million, which would simply predict that, oh, sorry, it's for 2023. That's why these brackets are so optimistic. So even if we add up these numbers and the fourth quarter of 2022 would yield another 300, 350, that would be around 1.2 million for 2022. And the question is whether they can make many more cars than that in 2023. So the baseline, I would say, would be an optimistic baseline, seeing these numbers and how steady the growth has become to cross even the 300,000 line. And starting with that, I would definitely not put any percentage below 1.2, 1.3 million. And this would be my lowest bracket. This would be the most, I guess, objectively doable bracket between 1.4, 1.7. And then I would try to do a gradual decline from there. But I would put my highest estimation for this third bracket. Let's see what the crowd thinks about that. No, they are actually, I was 1.4, 1.7. They are much more optimistic about that than myself. They put the highest estimation for 1.7 and 2 million. I would actually love to see some rationals for that. Like in this case, this forecaster did that. It's pretty ugly implications for Tesla stock. Okay. Most critical year for Tesla. Okay, let's see another rationale. Current maximum production capacity should be around 1.9 million vehicles. And it will probably grow from here to the end of 2023. So from now, we have around 1.2 million for 2022, and it will grow from there. So this forecaster thinks along similar lines like I did, putting the highest estimation for 1.4, 1.7. Actually, I would say that even if I look at the crowd forecast, it would be great to be able to look only for rationals about this, but I was not convinced by these. I'm not saying that I will change my prediction, but I will keep the bracket, the highest bracket in the third category, 1.4, 1.7. And I would love to get back to this in about 2 months. 1 month should be enough, so 4 weeks, to see whether I have to change anything about my prediction. All right. In the meantime, a few questions kept coming in. Of course, Jorge, I'm just sharing the link with you again. It's called the Good Judgment Project, and here is the link. After the COVID, we have the same view of the medical specialties. Yes, because of the impact of technologies hasn't really changed due to COVID. Burnout and mental health issues have changed, but not the impact of technologies. Jakub, why did you put any for the 2.6 million? Good question to ask. And the reason why is I just go back to that so you can look at what I'm looking at right now. The reason why is that I think the baseline should be around 1.2 million, but I just can't rule out that they will significantly get better, especially seeing that there are quite promising, or convincing sources that the production is expected to rise in 2023. So there's nothing that makes me think that they will not be able to significantly improve that. And this way, being granular helps. I think that your question implies that I should just go like 70% for this and 30 for the second highest group in the crowd. But I like to be granular about this. And if anything changes, if I see the fourth quarter number of total delivered vehicles, I might change it. I might even move from this bracket towards the last few brackets. But for now, I can't rule out that they will be able to produce more than 2.6 million. That's why I did that. Okay, let's do one more thing here. We have one question around the cumulative confirmed cases of monkeypox in the world. And the question is around how many cumulative confirmed cases of monkeypox will be reported in the world as of the 20th of November 2022. And they will determine the outcome based on this database, the Monkeypox Data Explorer. I've been looking at this in the last couple of weeks because of other forecasts I do in the super forecasting group. And as you can see, it's not a plateau yet. It's getting there, but there are certain days when there is a huge rise, a huge increase. But basically, I would say that between the end of September, the 26th of September, and today, we saw a rise of around 10,000 cases. Between the 26th of September and the 26th of August, it was about almost 30,000. I mean 20,000. So 20 before the end of between the end of August and the end of July, it was around 30. So 30,000, 20,000, 10,000. It seems like, there is a gradually a decrease in the numbers. And therefore, if I had to provide the prediction for the 20th of November, which would be like 24 days from now, not an whole month, and we are at 76,000 right now. So counting from here, I would not go over 10,000. I wouldn't say it would be much over 86,000. That would be my baseline. And I would start from there. So I think fewer than 76 is simply impossible because we are over 76 already. So of course that bracket will remain 0. I think this bracket to be the highest estimation, it would require that monkeypox is being eradicated, but I just don't see that happen. It would mean that less than 12,000 cases will rise in the next like 3.5 weeks. I said my baseline would fall into this category. So I think my highest percentages will go for these two categories, somewhere around 40-ish and 20, 30-ish, but I can't rule out the last one. And I think I can be even more optimistic about the second and the third bracket. But let's see what the crowd thinks about the same. Well, they are very optimistic about the last one, the second one, between 76 and 88,000 cases, 72%, and only 18 for the next, and maybe a few for the rest. Which means that the crowd thinks that the plateau phase is very close, and we will not see a gradual increase in the number of cases. That's a good rationale, and I would increase my score to that. I cannot be more optimistic about that at this point, simply because there has been quite sharp rises out of nowhere. Maybe data could get accumulated from different sources at once, and that's why we see these sharp increases randomly, week by week, day by day. But I would definitely come back to this in about a week to see how it changed. So I would go with that now, and in 1 week I will ask for a notification. All right. Now, coming back to you, I hope that you have been enjoying this forecasting exercise. Yeah, Madeline Mayer, it's a very fair question to ask how the war in Ukraine impacts the future of healthcare, especially because of resources and the lack of resources. There are questions about the geopolitical outcomes of that war in the Good Judgment project, but not about the impact on healthcare. It would be hard to quantify that at all. So again, good forecasters like to try to ask the right questions. They try to be as granular, as detailed as possible. They keep scores, and they are open-minded about changing their predictions based on new information that arises. You have to be very open-minded and look for, and actually if you start forecasting outcomes of different questions on the Good Judgment project, I guarantee you that you will ask for snippets of information and details when you scroll the news about those exact events. When I tried to predict the outcome of the elections in Kenya, because there was a question about that, I kept on looking for details about the election and polling results and all these, which I would otherwise have never come across, so looked for actively. But this way, by being engaged in the question and the Good Judgment Project, I decided to do that. So for now, again, I would encourage you to go to the Good Judgment Project. It's absolutely free community site. It's an excellent, very supportive community. You will meet people who are there to help you become better at forecasting. And it will be, I think, a joyful experience for you in general. If you want to get better at this, please read this book, The Art and Science of Prediction, the Super Forecasting Bible, if I can call this book that. In the meantime, we will keep providing forecasts about the near future of medicine and healthcare on medicalfuturist.com. For those supporting us on YouTube by joining the channel, thank you so much for your support. For those supporting us on patreon.com/themedicalfuturist, thank you so much for supporting the Medical Futurist channels and allowing us to create a range of free content across many channels. Plus, you also receive a lot of exclusive content that nobody else does on patreon.com/themedicalfuturist. And well, I hope that you had a good time. Thank you so much for being with me, so many of you around the world. This live stream, of course, will be published on YouTube in a few minutes. And please get ready, because in the next couple of weeks, we have quite the Q&A live schedule cooked up for you. Like, for example, in 1 week, on the 2nd of November, I will have a live about, in 2nd of November, 16th, and the 23rd of November, we will have live Q&A streams. One will be about what you all have to know about artificial intelligence going into 2023, all the new exciting stuff and studies and technological trends around AI. One will be about the top 100 companies in digital health from the Medical Futurist, the list we publish every single year. I spent weeks analyzing companies and choosing those ones that I can stand beside. The third one will be a live Q&A with Alvaro Goyanes from FabRx, and we will talk about 3D printing medications and drugs. He's the world's top expert about 3D printing drugs, so we will be able to ask questions to him as well, not just me, finally. So we will have a guest on the show. We will also have a year-ending stream where I will talk about, and you will be able to ask questions about new trends, exciting things going into the year 2023. So in general, there are many things we are cooking up for you. Thank you so much for being with me here today. Thank you so much for the very insightful, great questions, and see you at the next live YouTube Q&A from the Medical Futurist next Wednesday on the 2nd of November at 4 p.m. CT. Same time, but you will find all these details on our YouTube channel and also on the Eventbrite website under the Medical Futurist tag. So thank you again for being with me here today and have an excellent day. Bye.